when a surgeon is going to perform a surgery, they're balancing two things. They want to take as little tissue as possible because they want to preserve how it looks cosmetically. They also want to minimize complications, but at the same time, they want to take out, they want to make sure they get all the cancer. So they want to take the cancer and then some margins around it, some normal tissue around it, just to make sure that they have gotten everything. For research purposes, there are a lot of academic medical centers that keep banks of tissue, and we do research on it, and this is all with patient consent. Like, a patient has the opportunity to consent to allow us to have some of the tissue and to be able to continue to do research on it so that we can develop better treatments. A lot of people don't realize the pathologist gets involved actually during the surgery. If you had cancer and you needed to have surgery, let's say you have breast cancer and you're going to have a lumpectomy, and so you undergo anesthesia and the surgeon performs the operation. And when they perform the operation, they perform it very carefully, and when they take out the tissue, they actually mark all the margins the way it was laid out in your body. So they mark what's superior, like what's on the top, what's on the bottom, the different sides of it, and then they bring it on a tray down to the pathologist while you're still under anesthesia. And then the pathologist will prepare it so that they can tell the surgeon, yes, this is cancer. But if you think about what it looks like, if you take tissue out, like, it's all right, smushy, and somehow you need to find a way to take a thin slice of it and put it on a slide and put it under a microscope so you can look at it. So the pathologist freezes it, and it makes it hard. And that allows the pathologist to slice it into really thin slices, put it on the slide, and then look at it under the microscope. Any tissue that's collected as part of your medical treatment, it's never thrown away. It's always saved, and you can always have access to it later on. Like, for example, if I lived in Florida and I had a surgery and I moved to California, and 10 years later I needed access to it, I could call the lab in Florida, that pathology lab, and ask for it to be sent to where I'm being treated in California. You can use some of the same resources we use. One of the best resources is the NCCN guidelines, so the National Comprehensive Cancer Network. They have a website. You have to register with your email address, but it's free to register. And they have provider information that helps us remember everything that we need to test for a particular cancer. But they also have a patient section with patient information, and it is extraordinarily informative. It's all reliable, up to date, and very detailed, and it explains really everything about that cancer, not just the test that you need to order. The other place I would recommend is cancer.gov, and that is the National Cancer Institute website. Again, very reliable information, very comprehensive, and you can find out line by line, what is a pathology report? What does this word mean? What does this mean? What are the questions I should ask my doctor? And then lastly, mycancergenome.com. And this one is helpful because when you hear about all the new treatments and all the new genes, it's really overwhelming. This is a website that is really user-friendly. You can put in the name of the cancer or even the name of the mutation. Like, let's say you have lung cancer and you've heard about ALK mutation, ALK. And you're like, I wonder what that is. If you put that in on this website, there's like a search bar. It will come up and it'll tell you in very plain terms exactly what it is, what it's used for, if it's investigational or if it's prime time and it's something that should be ordered on, in your case.